Assalamu alaikum. Now I would like to discuss about a very high yield topic of the respiratory system, that is Flail chest. What is Flail chest? How to diagnose a case of Flail chest? If three or more than three contiguous ribs fractured in two different locations, so two, three or more than three contiguous rib fractured in two different locations, that is flail chest segment. Look at this X-ray in magnifying position. Okay, one segment, one location, another location. Three or more than three contiguous segment. In here again three contiguous segment. Look at this X-ray, three contiguous segment, two different location. Okay, findings is paradoxical chest wall motion with respiration. Paradoxical chest wall motion with respiration. So flail chest fractured rib, flail chest fractured rib 32, and paradoxical chest movement. Paradoxical chest wall motion with respiration. There is chest pain, tachypnea, rapid shallow breaths, chest X-ray show rib fracture with or without contusion or hemothorax. Pain control, supplemental oxygen, positive pressure ventilation with or without chest tube. If there is respiratory failure, then positive pressure ventilation if there is respiratory failure. So what are the things we need to remember in chest flail chest fracture ribs? Flail chest fracture ribs, that is 32. Remember this word 32. 32 is not a continuous like 23, so it is a paradox. So paradoxical chest movement, paradoxical chest movement. So pain control, and another P is for positive pressure ventilation if respiratory failure. That's all about flail chest. Okay, how does this flail segment move with respiration? Move inward. Paradoxical chest wall motion. Move inward due to negative intrathoracic pressure. This is very high yield. Move inward due to negative intrathoracic pressure. Okay, what is the most essential part of the management for an uncomplicated rib fracture? No hypotension, no pneumothorax, pain control, pain. Essential to maintain deep breathing and adequate cough, which prevents atelectasis and pneumonia. So it prevents atelectasis and pneumonia. The extreme blunt force is required to create flail chest typically injures the underlying lung, resulting in pulmonary contusion, seen on X-ray as infiltrates underlying patient's rib fracture, decreases oxygen diffusion due to alveolar hemorrhage and edema. As a result, patients must breathe harder to maintain oxygen. The combination is increased work of breathing, decreased oxygenation. Increased work of breathing, decreased oxygenation, and many patients to fatigue and develop respiratory failure require mechanical ventilation. Okay, now look at this question. This 25-year-old man is brought to the emergency department. Why? After a high-speed motor vehicle collision, the patient was restrained. There was prolonged extrication due to extensive vehicular damage. Supplemental oxygen and IV fluid are administered. Okay, good. pulse oximeter 88% on 10-liter oxygen and NRV mask. The trachea is in the midline and the neck veins are flat. There are several chest wall and abdominal bruises. A portion of anterior left chest moved inward during a portion this point a portion of the anterior left chest moves inward during inspiration. This is flail chest moves inward during inspiration. Breath sounds are diminished in the anterior left lung. Breath sounds are diminished on anterior left lung but normal elsewhere. The abdomen is non-distended, soft, and non-tender to palpation. The left thigh is deformed, but the compartments are soft and distal pulses are intact. Okay, which of the most likely cause of this patient's hypoxia? At this point, a portion of the anterior left chest moves inward during inspiration, looks like flail chest. And why? Impaired generation of negative inspiratory pressure. Impaired generation of negative inspiratory pressure. Okay, this is the flail segment. Three or more than three fractured ribs in two segments. Three or more than three fractured ribs in two segments. So hypoventilation of the affected lung. Hypoventilation of the affected lung. Okay, this flail segment paradoxically out moves out during expiration. It moves out during expiration and moves inward during inspiration. Okay, so flail chest negatively impacts respiration and oxygenation in multiple ways, including impaired generation of the negative intrathoracic pressure during inspiration and increased dead space during expiration, causing ineffective ventilation. So it causes ineffective ventilation due to increased dead space during expiration and impaired generation of the negative intrathoracic pressure during inspiration. So inspiration, impaired generation of negative intrathoracic pressure, and there is pulmonary contusion with alveolar hemorrhage and edema. Pulmonary contusion with alveolar hemorrhage and edema in the underlying lung impedes oxygen diffusion, and fracture related pain causes respiratory splinting, decreased inspiratory effort, and bibasilar atelectasis. Flail chest results in inspiratory failure, resulting in mechanical positive ventilation, which uh, due to positive pressure and can force the flail segment to move outward with the rest of the rib cage during inspiration. Okay,